You would think,
Now you're paralyzed.
don't have reflex. Okay, let me see some. So,
You need a cortisone shot.
wow, right? Yeah. Yeah, that's how they. Oh, I shouldn't say that. So you cannot do that because reflex, you have to wait until patients respond. So you have to do it once at a time. Oh, you cannot do this either. I see. I wasn't hearing that hard.
Sustained tonus.
You cannot do that too. But I was seeing this. Still, sometimes I got amazed too by patients on new brilliant idea. Okay, that was a 6 and 7. For 8, I usually so 8 and 9 is the same test. So for 8 and 9, you have to ask the patient to lay on their stomach. Can you lay on your stomach? Okay. So remember, patient have a problem on the right side. Okay. The reason that I made this way, this is a you can use this when you have a patient. When you when you see the musculoskeletal patient, then you can use this format. Okay, that's why I made this format. So for Eli test is this. Okay, patient have a problem on the right side. So here, this side. Right? If you want to, you can do both sides. Okay, but we don't have time, so I'm going to do on the pain side. Okay, I'm going to bring this your ankle to this side of a hip. Let me know when you feel any pain. Okay, don't touch here. Okay, don't touch here. Especially, no, even men. You never know, you know. You never know. Okay? Ready? Any pain when I do that? Okay? That's Eli or Naklas. Right? Okay? And then femoral nerve traction test is this way. You can do on, I usually do on this position, but you can do sideline if you want to. And this is how I do. I cup patients to relax. Okay? So if he's relaxed, then I can move his leg. Okay? So you lift this leg up to the ceiling. Any pain when I do that? Okay? That's femoral nerve traction test. Now, according to the handout, is this way. Can you lay on your side, this side up? Supposedly, slide up a little bit. Supposedly, according to the handout, is this. Bottom leg, this way. You hold it up. Okay? You're supposed to do this way. Okay? But when you open up your practice, changing patient's position take a long time, especially when they're in pain. So I usually do without changing their position. So doing this versus lay on your stomach. This is the same, right? So that's why I do is this way. Okay, that's a femoral nerve traction test.
You always do on the injured side, you don't do on the other side?
You can, actually for your benefit, you better to do it both sides. Then you don't need to explain anything. Some patients literally tell me, if I used to only painful side, then patient will tell me, oh, that's normal to have the pain. And I will show the non-painful side. Oh, that's not supposed to pain? Oh, and so usually if you do it non-painful side first, then you don't need to explain anything. Then patient know that when shows up something, they know that's abnormal.
Wait, when you're pulling his leg for Eli, it's
Eli, huh?
you're asking him to give you feedback, or are you saying, is there pain, is there pain, is there pain? Like,
Oh, you have to ask the patient's feedback.
ask him to stop?
Oh, no, you don't need to ask the patient to stop. You just bring the patient heel to all the way up to the hip.
So there's no degree, it's just all the way to the end?
All the way to the end. Yeah, you don't need to, this is not for degree. Only straight leg raise test and well leg is a degree.
Where's the pain supposed to be?
Oh, for not class test, anywhere around. It can be here, it can be here, it can be here, it can be here, or it can be inside. That's wherever the pain is, that's the indication for not class. Eli is when I do this, instead of patient telling you where the pain is, patient will hunch up like this.
Oh, that's right. Okay.
That's Eli. But same not class, Eli same test. But the positive finding is different. It's not easy to. Any question up to number 9? Cross out for number 10.
Number 10?
Cross out number 10. Can you stand up, please? No, stand. For lumbar, okay, number 11 is a lumbar range of motion test, right? Flexion, there is a flexion, extension, external, lateral flexion, and rotation. Okay, so for demonstration purpose wise, I'm going to do the lateral flexion and rotation first. Okay, for lateral flexion and rotation, you have to face the patient. There's a different way to do it. You can instruct the patient what to do, or you just show the patient what they need to do. Okay, let's just mimic my movement. Can you do like it? And the other side. Okay, make sure lateral flexion. There's a left lateral flexion versus right. If you only do right lateral flexion, not left, then I will cut out the point. Okay, you have to do both sides. Okay, and rotation is this way. Yes, and also this one. Okay, look at me. You have to watch patient's movement. Okay, I've seen this. Can you do this? And you're not even looking at. Then why are you doing the range of motion? I don't know. So when you do it, you have to watch. Can you do it like this? Okay. Then you have to watch how far the patient can move. Or do it slowly.
Oh.
Like if you when patient moves this motion fast, that's causing the muscle or low back muscle gets spasm up. So I ask the patient to slowly turn their body and the other side. Okay, that's a rotation. Okay. For extension and lateral flexion for lumbar, you have to stand next to the patient because you have to see how much that they can move. So, next to the patient, just mimicking my movement. Can you like do this? Okay, okay, and back up. And can you move like this? Okay, so you have to watch. He's very flexible. Okay, so you have to watch how patients move because you have to have an idea. You have to get a degree of the patient's how far patient can move. And for practical exam, you have to after you perform this, you have to tell me what is a normal range of motion is. Okay, so flexion 80 degree. Extend 20 to 30, lateral flexion 35, rotation 45 degrees. You have to tell me that afterward. Okay? For active hip range of motion, For hip range of motion, you have to ask the patient can you hold the table like this? Okay. If you want to move left side of patient's hip, then you have to stand and get. To show the patient, you have to use, to move patient left hip, you have to move your right hip, right? Because patient have to mimic your movement, okay? So, I will do the abduction first, and internal and external. And the flexion extension I will do later. Okay? So, can you follow my movement? Can you do this? That's abduction. Can you do like this? That's adduction. Okay? And then can you bring your toe in like this? That's internal rotation. Can you do like this? That's external rotation. Okay? But make sure when you do this, ask the patient to hold something. Ask to hold the table or wall, wherever that is. When patient fall, they might sue you. Okay? So for flexion and extension, I know the flexion there's two different flexion on the handout, right? But I will show you both of them, but you don't need to. Which hip movement did I show you on your handout? Oh, sorry. So you don't need to do first part. You don't need to do flexion with a knee flex 120. You don't need, you cross that out. I better cross it out now so I won't confuse you guys. But there is a two different flexion though. Okay. 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 I will show you both of them though. So flexion with knee flex is this way. So ask the patient to grab, hold that, and then you using this leg. Can you raise your knee up like this? Okay. When you bring the patient's hip into flexion, if patient bend their knee, they can actually bring it more. Okay, let's try again. This time, do not bend your knee, straight your knee, and bring your leg up like this. Okay, see, it's less than before, right? This versus this, right? Here is a lot more than, there's a lot more difference than either, right? That's the flexion for the hip. Extend is this way. Extension is like do this. Oh no, using this leg. Got it. When you do this, don't confuse your left and right. Okay? And you do it like this. Okay. Oh, because of that, you cannot move.
Need to straight the knee.
Yeah, better to straighten. Yeah. Okay? That's the extension. You have to watch the patient.